Today we will be discussing the radioisotope Cobalt-60, which is the radioactive isotope of Cobalt-59. It has a half-life of 5.27 years. Adding an extra neutron to Cobalt-59 is the way in which Cobalt-60 is artificially produced. Through beta decay, Cobalt-60 emits gamma rays and is transformed into nickel-60. Although the energy of beta decay is low and easily isolated, the energy of the gamma rays are very powerful. Gamma rays are the strongest form of radiation and the only form of radiation that can penetrate human tissue, thereby making them effective in medical treatment. Cobalt-60 has many uses, from sterilizing medical equipment to treating cancer and destroying tumors. Unlike other forms of radiation, Cobalt-60 therapy can be used anywhere in the body, and in particular, doctors use it in patients with brain tumors. This is because of how precise the radioisotope is in attacking the area of concern, which is important when dealing with brain. Cobalt-60 allows the doctors to deliver high doses of radiation to the affected area with limited damage done to surrounding areas. An example of such radiation is gamma knife technology. This is where a gamma knife containing 201 Cobalt-60 sources aims gamma radiation through a point in the patient's brain. The patient wears a helmet that is fixed to their head so that the brain tumor does not move as the gamma rays penetrate. For today's purpose, we will use army soldiers to represent the gamma rays that are used. We can see how they manifest in attacking the tumor and eventually destroying it. The gamma rays are delivered precisely to avoid damaging healthy brain tissue. The risks of such radiation are very low, and so far, gamma knife technology has proven effective for patients with harmful brain tumors. As a result of the simple design and effectiveness of Cobalt-60, doctors have been using it to treat cancers for over 60 years. When looking at the benefits in regard to using Cobalt-60 for medical treatment, it can be seen that the major benefit is that it can cure cancer. Cobalt-60 therapy is also relatively cheap, as well as being quite painless in comparison to other forms of radiation. Additionally, the gamma rays that are emitted from the radioisotope are effective in killing pathogens and bacteria without damaging other areas that are exposed to the rays. In contrast, problems such as a short half-life mean that the radioisotope needs to be replaced every few years in order for it to have the best effect. Additionally, if not handled and used appropriately, Cobalt-60 can do a lot of harm to the human body. Basically, it can cure cancer, but when not handled properly, it can also cause cancer because of the harmful rays that are emitted. Although there are some risks involved when using Cobalt-60, the benefits definitely outweigh the problems. In the long term, being cured of cancer definitely outweighs the slight risks of radiation exposure. Additionally, patients who are treated by Cobalt-60 do not have to suffer the pain and sickness that occurs with traditional surgeries. Furthermore, since its introduction in the early 1950s, Cobalt-60 has saved over 35 million lives worldwide. Therefore, it can be seen that the benefits associated with the use of Cobalt-60 in medicine outweigh the problems, making it a good source of radiation for cancer treatments. Thank you.